Dr. Lucky Seacon. I'm a board-certified REI, and I want to talk to you today about minimal stimulation IVF. Minimal stimulation or natural cycle IVF is based on this premise that when you use medications to stimulate all of the eggs that are available in a given cycle, that you may be overriding natural selection and causing the growth and extraction of eggs that were never destined to ovulate. Proponents of minimal stimulation or natural cycle IVF think that it could lead to better quality eggs. Every cycle, you have a bunch of eggs of the total number stored in your ovaries that get pulled to the surface of the ovary, and then your brain sends a signal to one of them to select to mature the dominant follicle, and then you release or ovulate that follicle. When you're doing IVF, the goal is to get all of these to grow like so. I think a major fallacy here is this idea that our brain sending the signal to select this one egg somehow knows best and can select the best egg. But if that was really true, no one would ever have miscarriages and it would be much easier to get pregnant. The truth of the matter is it's a really random process. I am not a fan of minimal stimulation or natural cycle IVF because IVF is truly a numbers game. Not every egg is destined to fertilize, turn into an embryo. Not every embryo will be genetically normal. So the whole reason or purpose behind IVF to improve the inefficiency of reproduction is to start with a larger number than just one or a few eggs in the hopes of watching them survival to the fittest, get to the finish line, and you could even genetically test them, and then hopefully you end up with a certain number of embryos that are genetically normal and have high reproductive potential. If you give lower doses of medication on purpose, or you just use their natural cycle, you're limiting yourself to working with one or very few eggs, and given all the attrition we expect, that's going to drive up the number of cycles needed to be successful, and it's going to make a potentially very efficient treatment option way less efficient and way less effective. You might be concerned and say, well, what about the quality of the eggs? Want to get better quality with lower doses of medication? We actually published a paper using thousands of cycles worth of data from RMA of New York over the past 2 decades and showed that the dose of medication used during the stimulation had no bearing or association with the percent of embryos that tested as normal or abnormal. Even studies focusing on natural cycle IVF, where no medications were given, showed there were no difference in the rate of finding embryos that were genetically normal or abnormal. However, they did note that it took several more cycles to get a normal embryo. No surprise when using a natural cycle. Obviously, every patient is an individual, and I never speak in absolutes. So I might consider using lower doses of medication in patients who have very low reserve, have demonstrated a low response to treatment despite using the conventional high dose approach. And maybe they're paying fully out of pocket for medications and it's not practical to give them very high doses, which are not going to produce a markedly different response versus giving lower doses. But beyond that, I never do minimal stimulation or natural cycle IVF for the indication of trying to get a better outcome with IVF. Because like I said, IVF is a numbers game, and my goal is to control what I can control, which is getting as many mature eggs to start with, because the rest is really up to egg quality, sperm quality, and things that are out of our control. IVF is a numbers game, and I'm never going to try to get less on purpose.